TCM. So by definition, this is a Medicare service and it is clinically aimed to ensure that patients have proper follow-up care for after they leave the hospital right after they're discharged. And the whole goal of TCM is to reduce hospital readmissions. We're trying to improve patient outcomes, ensure continuity of care, bridging that gap between a hospital-based care and outpatient care. Really all good reasons right to provide this type of service, but the trick is being able to comply with some very specific tiny rules so that you could actually get paid for. So today we're specifically talking about Medicare guidelines, but many commercial payers do follow similar rules. But it's important to recognize that we gotta make sure that you understand commercial payer requirements. If you do have certain heavy commercial payers, you may want to look up their policy and be able to evaluate how they manage this. So what is a TCM? In the sense of what you're trying to do when you see these patients. So obviously patients experience a lot of complications when they leave the hospital, right? They can have confusion around what medications they should be taking. They could have unaddressed concerns or even new concerns crop up, and so without proper follow-up, we all know the patients may deteriorate, right? They may lead to unnecessary readmissions or even worsening healthcare conditions. So TCM's a service that was developed to try and promote transitional care so that these patients have better options around post-discharge follow-up. Obviously many of this is already happening from our primary care physicians or even our subspecialists, and this is just another more specific way to get paid for it and reward the work that you're already doing and make sure that that outpatient care is seamless and that there is somebody dedicated and assigned to figure out how to transition these patients effectively and have high touch points when it comes to managing either their acute issues, their medications, their therapy, or coordinating other as subspecialist visits.